Okay, everybody, thank you for joining us for tonight's Ask Me Anything live session. Very, very excited to have Dr. Larissa Flores here joining us tonight. Thank you so much, Doctor. I really appreciate it, and I'm very excited to talk to you tonight because I just love your Aspen story. So first off, those of you that don't know what you're participating in, this is a live Ask Me Anything session for Aspen Dental. And if you don't know who Aspen Dental is, I can help you out with that. We are the largest branded DSO in the nation. We have over 840 offices across the country, and we are a yes organization. And by that, I mean yes to everything. We carry your insurance. We can see you that same day. We have a denture lab in every office. We do our best, our very, very best at patient care, and we put that first. And the outcome is very happy patients and very happy Aspen Nation. So I think Dr. Flores can attest to that. Dr. Flores, I'll give you the floor. You can, I just want to let you know there's people on that are participating from the great state of Texas, as well as some dental students from your alum.
Awesome. That's so great. Hello,
So you can give a
everyone.
shout out.
Hello, everyone. It's a pleasure to be here today and to be able to do this Ask Me Anything session. I'm Dr. Larissa Flores. I am a Temple 2019 graduate, and I am born and raised in El Paso, Texas. So I'm a Texas girl, but I went to school in the Northeast, so I've been a little bit to all places in the United States, which is great. And a little bit about me, like I mentioned to you, I am from El Paso, Texas, which is in the border of Mexico and New Mexico. And I live in that border town between Juarez and the United States, of course, El Paso, Texas. So I'll give you a little bit more about myself as the questions come through, but just to let you know, I've always wanted to be a dentist, and it's amazing that now I get to live my dream, and it's a blessing that I get to live it through a company that's been as great and wonderful as Aspen has been for me. I am happy to announce that I will be opening up my very own Aspen Dental here coming soon in December of 2020 this year. And it's really exciting. I'll get into all of the details soon, but I just want to let y'all know I've been extremely blessed and very, very fortunate to have had the opportunity to pair up and team up with a company as great as Aspen, and to be able to say that I am going to have something that I can call my very own with the help and backing and support that Aspen can help and give us as dentists. So if you guys want to ask some questions, I can go ahead and start answering.
Yeah, I have a couple first. I just want to, the way your story came to me was through Kim Keenan, and she had told me, so those who have had contact with her or not, she's a recruiter for Aspen. And
I love Kim. She's
yes,
great.
so she was telling me that you really wanted to be in El Paso, and you made your first stop Midland, Texas,
Yes.
knowing, and everybody knew that you wanted to get to El Paso. So how long have you been in Midland, Texas practicing?
I practiced for 1 year in Midland, Texas.
Okay.
And before the pandemic, of course, the plans were to open El Paso at the end of summer. However, things change, and we're all flexible, and we all figured out a way to work through it. And it got pushed back, but still 2020, which is amazing to me.
Mm-hmm. Great. So we spoke just the other day, and you're in Wichita right now.
I'm in Wichita Falls right now.
Okay. And so tell me a little bit about that. You're floating a little bit. Are you covering for somebody that's out, or what's the circumstance?
Yeah, so basically, I wouldn't call it floating really, because I'm only going to Wichita Falls right now, but
Okay.
it is something similar to that, just because I worked in Midland for the year, And because everything got pushed back a little bit with my El Paso office, they decided to offer me, in the meanwhile, while I was waiting for El Paso to happen, the opportunity to work out in Wichita Falls, which has been great so
Oh,
far. I
good.
travel in on Mondays, and I work Tuesday, Wednesday, Thursday, and half day Friday, which has been great. And I get to go back home to El Paso Friday. In the evenings, I get there, and it's amazing. So that's what I've been doing for the last couple of weeks. Really, it's already going to be 4 weeks, which
Oh,
time
okay.
gone by pretty fast. And I've enjoyed it thoroughly. It's been great. I think I'm going to be visiting Brownwood
Okay.
here in a bit, which is
Yep.
great. I look forward to that. And it gives me an opportunity to take a look and, see what every office
Mm-hmm.
does and how they run, and take pointers from everyone, because you can always learn, and that's
Right.
something that I feel like we can all take into account. There's something that you can learn from anyone and everyone,
Mhm.
and you have to take every opportunity as it comes and see it as a growth opportunity, as a way to learn something new.
Right. That's great. So, ADMI, so Dr. Flores and I actually work for two different companies, you could say. So she works for Aspen Dental, and I work for Aspen Dental Management, which is the support mechanism that supports the Aspen Dental offices. So when Dr. Flores opens her office, she is going to be supported by ADMI with everything business side of things. So payroll and accounting and collections and recruiting and marketing and all the business aspect of her business. She'll have that support so she can focus on patient care. You're going to have the ability to hire your staff and build a team that is going to be right for your office.
Yes,
That's
absolutely.
exciting.
It's super exciting. I'm about to get started on that process, so I'm
Yeah.
extremely excited. Here in September,
Mhm.
mid-September, I'm gonna start my very first interviews, which I still get little butterflies in my tummy when I talk about it.
You're probably going to have some Temple grads knocking on your door, maybe.
Oh, I would love to have some Temple grads come. I have to say, I mean, I know Texas schools are great, and I would have loved to go to a Texas school if I hadn't gotten into Temple. I do
Hmm.
say Temple was my number one because my fiance was a Temple podiatric student
Oh,
when
nice.
yeah, so that was my number one, being out in the Northeast, just so that we could be closer. He was my
Hmm.
fiance then. He's actually my husband now, I should say, correction. And my choice to go out to the Northeast was so that I could have a family member near me. And it worked out great. Temple is a great school. We have great clinical experiences out there. So if I had some Temple graduates that wanted to knock on down and wanted to be Texas dentists, I'd welcome it. I'd love it. I
That's
definitely
great.
know it's such a great dental school. And, Texas is a wonderful state. It
Yeah.
really, when it comes down to practicing, you can practice very freely and comfortably. And as a home for most people,
Hmm.
they'll tell you, pretty much anyone that lives in Texas will tell you Texas is an amazing state. We're very Texas proud.
Yes.
And they'll let you know that, you're not going to find better cost of living or size of living than you
Hmm.
can in the big state of Texas. So,
Oh, that's great. Good.
yeah.
So I've got questions. They're on two different screens, so I'm going to be looking left to right. I want to just kind of ease into this question. Someone is asking what your recruiting process was like and why you chose a DSO over a private practice.
Yeah. So my recruiting was a little bit different from most people's, just because I was the Temple ASDA's continuing education liaison. So basically, what
Okay.
that means, as you guys know, in dental school, we have ASDA, that you can be a part of, and we organize lunch and learns and different vendor fairs and things like that. So since I was a freshman, starting off, I started strong with ASDA and worked my way into vendor liaison and continuing education liaison. So basically what that meant is I was the person in charge of contacting all the vendors, the DSOs, different companies to come and present at Temple so that our students can get all the information that they could gather as dental students so that they can make an educated decision about what products they wanted to use and what companies they might want to work for, whether they be private or DSO companies. So from the very beginning as a freshman, I was exposed to all DSOs, all private practice models, and I would invite people to come and speak. And I made great friends with a couple of people from Aspen, Molly and David. They were both the people that I would be in contact with all the time regarding, lunch and learns and vendor fairs and everything. And they were the people that were coming through from ADMI to speak to students. They weren't necessarily recruiters. They were just there to present the options and to give people information as students. So they're called the academic team, basically. And they come through and, I built great friendships with them from the very beginning. And I have to tell you, I saw every single platform, all DSOs firsthand. I was a person there greeting and meeting everyone. And I loved Aspen because the way the people that worked for it loved it, and how all the other students that, had previously gone to Temple and were currently working at Aspen would speak highly of the DSO model that Aspen had. I was very fortunate to get a glimpse at, what Aspen did versus what other DSOs did. And I compared for a really long time. And as a freshman, I really thought, okay, I'm not going to decide yet whether I want to stay in general. I came in thinking I wanted to be ortho. Then I found out, goodness, no, I don't. I love the idea of ortho, but then you realize like it's all physics. And I was like, I don't know if I really want to get into that. And also I realized how much I love general dentistry when it came down to restorative and fixed and removable. I just loved it. So I wasn't ready to give that up. So I started to explore my options outside of specializing. And of course, I always thought, well, I want to own my own practice. I want to have my own place. But financially, it's kind of difficult nowadays, especially as you know, dental students, we come out of school with almost anywhere near $500,000 in debt, which is insane. Some a little less and some a little more. So I knew that financially it would be a little bit of a leap, and I would have to probably work for someone for a while before I can make that commitment of opening up my own practice. But lo and behold, Aspen gives you that opportunity, and it's financially reasonable, and you have the backing, whereas most people are a little afraid to go into private practice because they don't know anything about business. So it's wonderful because Aspen gives you that best of both worlds. You get to practice and do your own dentistry and go by your own rules and decide what your treatment is going to be based on your principles and your ethics and what you want to do as a dentist, with the backing of a support system that takes care of all your business. You can be as involved as you want to be, which is great, or you can be as, far away from it as you want to. It just depends on what you're looking for. So I've been blessed to have that opportunity bestowed upon me, and now I'm like super excited. I'm one of the people that wants to be a little more involved, but I have to say it's been nice seeing it from all points as an associate, then later an MCD, which means that you're the clinical director that's a little more involved in the business aspect, and then soon to be a POP, which is a practice owner.
Great, great. Yeah, thank you for just elaborating on that. I have a question here about mentorship. So how do you feel your mentoring went when you started with Aspen Dental?
So mentorship is different. Everyone comes out of school feeling different. I personally felt pretty comfortable coming out of school with my education and how I felt when it came down to treatment planning and actually performing treatments. So I didn't require a lot of mentorship. Not that I didn't need it, because I don't need to learn things. Of course I do. That's not, but it was more like I was given the opportunity to go ahead and go on my own and, dip my feet in first and then jump into the deep end and go about it that way. So I didn't actually ask for much mentorship. My requests were, of course, being in a Texas city near El Paso, as close to home as possible, and to be in a situation where I could develop my leadership skills, which is exactly what I was given. I was given the
Yes.
opportunity by my POP, Dr. Shingala, to run the Midland office and be there on my own so that I could test my own abilities and really find my potential in leading so that I could eventually be on my own, obviously, in my own practice.
Oh, that's excellent. That's great. Yeah, wonderful. So you mentioned you had a fleeting moment where you were thinking about ortho. Um, we do offer Invisalign. Have you been
Yeah,
trained on Invisalign?
yep. I've been trained on Invisalign. So it's funny because they'll tell you when you go into dental school, you will get trained for ortho. It's a very minimal training in most schools. I don't want to speak on every program because I obviously don't know what every school's curriculum looks like. But Temple basically will give you a class on ortho that's a very surface level education. And then you get an 8-hour Invisalign training to become Invisalign certified. Well, obviously, I don't know about all my other classmates, but I came out thinking like, oh, I don't know how I feel about that. That seems more complicated than what I expected it to be. And I didn't try Invisalign until I got trained by Aspen, which made it crystal clear, super duper straightforward. And I was trained in December in Philadelphia. We did a CE course there. It was a 2-day course that gave us the groundbreaking rules and tips and tricks on how to make an effective treatment plan for Invisalign. It broke down all the good things, like who you can see and who you should refer, how you feel. It kind of teaches you how to get a little more comfortable at treatment planning Invisalign, and then how to write a good script. And then, of course, we had Dr. Geller. We have Dr. Galante now, who is an orthodontist, but the doctor who taught me my Invisalign lift course, that's what we call it, was Dr. Geller. He created what he calls the Geller method, or it's like a mechanism that he writes. It's an algorithm that solves all of your Invisalign questions.
Right.
Basically, it was pretty cool because I got trained in December, and the week I got home from my training, I felt comfortable enough to start my very first Invisalign case.
Wow.
And I've done many after. It's been really exciting, super duper helpful. And it's something that is not only for aesthetics, which unfortunately a lot of people are under the impression like, I'm fine with the way I look. That's not really the case when it comes down to it. You want to make sure that you have ability to, have periodontal health, and crowding does not allow for that a lot of times, as you know. So it's one way to resolve crowding and resolve periodontal health issues. And it's another way to make sure that, occlusion is best so that we can have a better occlusion so that we don't develop any problems like fraction lesions and cervical lesions like that. So
Mhm.
it's been great. I loved it, and I was able to break away from that shyness that I felt initially because I was trained by Aspen in our Lift CE course, which was great.
Oh, that's great. That's great. We've got some questions coming in. Anybody who wants to pose a question, there is a Q&A box at the bottom of your screen. So you just click on that and you can ask a question for the doctor. So talking about Invisalign brings me to this question. So what equipment do you have in your office that enables you to treat your patients?
So we have an iTero in my office, which is great. I love it. I don't know
Mhm.
what I use it for Invisalign. I use it for my removable partial dentures. I use it for my crowns, and I use it for patient education, which has been great. You know, people see what's going on. It's super duper helpful to, you know, take a look and see, look, this is exactly what I'm seeing. You can take a look at
Mhm.
and you'd be surprised. People don't know what their mouths look like.
Right. I was quite astonished. So I've been an Aspen patient for 10 years, far before I joined Aspen as part of the academic team. And the iTero scanner really opened my eyes.
Yeah.
And you were talking about Invisalign treating other things. You know, I've got a little crowding even after years of braces in my youth. And it's also, I'm going to take it on. I mean, it's also going to help with some clenching that I'm doing, you know? So there are so many benefits to it as
Yeah,
well.
definitely.
Yeah. So do you have a cone beam scanner in your office?
I will in my new office, which is really
Okay.
exciting.
Okay, great, great. So we have questions about uh, how many cases do you see? How many patients do you see in any given day?
So it all depends. Basically, when it comes down to production, which is what we call our fillings, our crown preps, our bridge preps, when it comes down to having RCTs or extractions, anything like that, that is what we call production. Basically, I'll see 3 to 4 patients on my production column in the morning and 3 to 4 in the afternoon. So if you think about it, a day is broken up 4 hours in the morning, you get your 1 hour lunch break, and then 4 hours in the afternoon. I'll see 3 to 4 production patients in the morning, depending on the degree of difficulty of each case,
Mm-hmm.
and then 3 or 4 in the afternoon. Then we have new patients, which is anywhere between 4 to 5 new patients in the morning and 4 to 5 in the afternoon. Every now and then we'll have 1 or 2 extra patients plop in because they are emergent patients, they're in pain, they're experiencing discomfort or swelling, and we want to get them in ASAP. They're called our high needs patients. And typically 1 to 2 patients in the morning in our high needs column and 1 to 2 in the afternoon. And then we have our overflow, which basically means I don't necessarily have to see these patients. It's typically denture adjustments or some post-ops from full mouth extractions, people that are coming in because we have to check something because we found a lesion that we want to check up on, make sure that it's nothing that we have to be concerned with. And typically what we'll see is anywhere between 4 to 8 in the morning, which is our overflow column, and then 4 to 8 in the afternoon. Keep in mind, I'm not seeing all of these patients. I'm seeing the patients that need to be seen by me, but a lot of times adjustments, if you teach your assistants how to do them, they can take care of immediate denture adjustments. And then of course, if you're delivering any crowns or delivering any dentures, you can go ahead and put them in that column because
Mm-hmm.
they're not going to take up a lot of time. Um, your deliveries are pretty smooth typically, and you'll be the one doing your adjustments on your permanent restorations, of course. But typically, when we're scanning with iTero, it's pretty straightforward. And when we're delivering with our lab technicians, they do a lot of your adjustments. So a lot of times, it's just you go in there, it slips in, minor adjustments here and there, and it's pretty straightforward.
Okay, great, great. There's a lot of happy people on that delivery day, isn't there, when they
Oh yeah.
receive their dentures? It's
Yes, absolutely.
exciting.
It's a big
Yeah.
blessing to see that.
So this question came in, are you in control of your own treatment planning?
Oh yeah, absolutely. I wouldn't have it any other way. It's
Right.
funny because, of course, I mean, I'm going to be completely honest and transparent. When I first came into dental school and I first started to find out about DSOs, you know, we call them like corporate dentists, dentistry offices, and you have this mindset that they tell you how to treat your patients, they tell you what to do, they tell you you need to do these amount of fillings or these amount of extractions, whether or not the patient needs it, that is absolutely not true. That is not the case at all. What we do is, you're the dentist and you're in charge of your schedule, you're in charge of your treatment plan, you're in charge of performing that treatment. And you, and only you, can dictate what is going to happen. If a patient comes in and they need a filling, they get a filling. If a patient comes in, they need a root canal and a crown, they get a root canal and a crown. You're not going to be doing something that the patient doesn't need. You're the one saying diagnosis, and you're the one deciding how to treat the patient. So it's all up to you. You never have to feel pressured. You never have to feel uncomfortable about being put in a situation where someone else is dictating your treatment. Now, if you're in an office where you have an MCD and you're the associate, you might find yourself seeing some of the MCD's patients. And if you don't happen to see eye to eye with the treatment plan that was proposed by the previous dentist who did the exam, you're more than welcome to change the treatment. It's happened several times. A lot of times you will see eye to eye with the treatment. But schools of thought are different, and dentistry is subjective. There's many ways to get from A to B in dentistry, as you know. So you can change your treatment plan if you wish to, and you don't have to feel forced to do anything that you're not comfortable with either. If you need a refer, you can also refer.
Mhm. So let's talk about that. Like, so Aspen does have specialists that come into different offices. Have you, like, say in the Midland office, was there an oral surgeon or an endodontist that came in on some sort of, continual basis?
Yeah. So we do have specialists come in through our office. In Midland, we had an oral surgeon, and in Wichita Falls, we have an oral surgeon and an endodontist who comes and visits us. So it's been great, super duper helpful. I personally know how to do molar endo. I wish not to. So I go ahead and I refer my molar endo because one of two things. I don't want to be stuck in a chair for 3 to 4 hours and keep my patient in the chair for 3 to 4 hours while I do a molar endo, when I know that someone can do it better in half the time. And that's what root canal endodontists are there for. You know what I mean? You can refer to them, have them do the treatment. And the second reason is I want to make sure my patients receive the best care possible so that their prognosis is as great as it can be. And if I know that an endodontist can provide a better prognosis for my patient, why not? So I do a referral for my molar endos, and I do premolar and anterior endos myself. And I'll refer very few oral surgery cases unless my patients want to be sedated, or of course they're really complex third molar extractions. But I personally like doing my own extractions. So if I can and the patient is not looking to be sedated or the complexity is, at my level, I will definitely take them on.
Oh, good, good.
Have the option to refer, which is great.
Right, right. Yeah, that is good. So I have a question here about, well, I'm going to switch gears a little bit and just cover things because of the onset of COVID. I have a question here. Did the office in Midland where you worked at the time, did they close because of COVID?
So we did close Midland. We had an office that was 15 minutes away in Odessa. Basically, Midland and Odessa are towns that are about 15 to 20 minutes apart driving. They're really close. A lot of people refer to them as Midessa. And basically, we took the furlough option, which is
Mhm.
basically, originally they told us, if you or anyone in your office is not feeling comfortable with the pandemic, or you need to get home because, as you know, schools were starting to be closed and people needed to be home with their children or with their loved ones, you can opt to close the office or stay open and have a minimal amount of staff, which would be what we call a skeleton crew,
Mhm.
to see patients for emergencies. And in the Midland office, because Dr. Shingala was in the Odessa office, which was only 15 minutes away, we closed the Midland office, and our patients that were emergent patients were seen in the Odessa office.
Oh, that worked out well. That worked out well then.
Yeah.
Someone's asking what were the precautions that were taken to open the offices back up? So what is the routine that's happening right now?
So basically, when we first opened, we opened only to see emergency patients because we were trying to be as cautious as possible. We were making sure that we had enough PPE so we could see patients in a safe manner. And we wanted to operate in a way that we knew we were doing what we had to do to make sure that the office was a safe environment for not only our patients, but also for ourselves and our staff. So we were able to acquire the appropriate PPE, meaning N95 masks, our level 3 masks, gowns, headgear, and foot protection as well. And when we first started, we basically were seeing people that had swelling or pain. We were doing extractions. We were minimizing our aerosols production, and it went pretty smoothly. We were seeing very few people, again, because it was for only emergency cases, and we were screening everyone prior for them arriving. We were doing our phone screening when we were doing our confirmation, basically asking people if they had been exposed to anyone, if they were experiencing symptoms, if they had any reason to believe that they had COVID or were exposed to someone with COVID. And then the day of the procedure, people would come in, sign in electronically, well, by phone really, because they'd call our office, and our office staff would go ahead and check them in. And then we'd call them when their room was ready for them to be seated. They'd take temperature before bringing the patient back, making sure that everyone was not running a fever. They'd bring them back to the room, and we'd go in there. PPE would be changed, of course, immediately after the patient was out of the room. And we make sure that people are not in the waiting areas. So we try to practice social distancing in that way. Of course, people come in, still they're wearing their masks. They're being called in when their room is ready. So they are given the option to wait outside, and preferably they wait outside. If they, for whatever reason, we live in Texas, you know how hot it gets in the summer, someone is not coming in by car, for whatever reason, they came in by ride or public transportation, they do have a place to be inside, but we are practicing social distancing, of course, following the same rules when it comes to PPE, and making sure that we are taking care to sterilize and sanitize everything, even more so than before, which we've always been really great at sterilizing and sanitizing everything. As you know, in the dental profession, we've been known to keep everything very, very clear, especially nowadays.
Right. Well, let's talk about PPE. It's my understanding that you have continual shipments coming in, so you're never running out.
Oh yeah. So thankfully, you know, we're very, very blessed. We have the shipments coming in. We have our N95s available to us, level 3 masks. We provide our patients with masks as well if they come into our office without one. Texas really doesn't have a lot of problem with people not wearing their mask because it is a mandate. And typically when they come in, if they don't happen to have a mask, we offer them one immediately. And we're protected at all times. Our staff is protected at all times. People are getting their temperature taken and their COVID screening done before they arrive, and the day they arrive, it's confirmed to make sure that nothing has lapsed in the last 24 hours since the confirmation was made. And I feel safe. I feel very safe, thankfully. I've gotten to feel, it's strange because I know we're in the middle of a pandemic, but thankfully I have the peace of mind. Sometimes I even forget that we're in a pandemic. I forget that we're wearing a mask all day. It just happens to become, you know, habit.
Right. Oh, that's good. That's good. So, I have a question here. Are you offered CE, continuing education, through Aspen Dental?
Yeah, we sure are. So basically, it was kind of helpful during the pandemic when, we first closed down the Midland office. We were given the opportunity to do as much CE as we wanted, and they signed us up with a live CE course, which was great. We could do CE through Zoom, which was awesome. I did a bunch of Invisalign Zoom CE courses, and I did a bunch of restorative and pros driven CE courses while I was at home during that moment when we had closed for COVID reasons. So it was really super duper helpful. I was able to keep up with that. Being a first year grad, I'm not expected to do CE courses, but I did like 30 hours in CE, which was
Oh,
great.
good.
I could have done more. I could have done more. There's way more time in those weeks that I was there, but I got
Mhm.
a ton of it done. And it's kind of exciting because I have it all on my phone. It was really simple, really straightforward. I do miss traveling and seeing my colleagues at CE courses, but I know eventually we'll get back to that.
Yeah,
It was
we'll
super
get back to that.
to be able to do it from home though.
Right. So those of you that are listening, Aspen Dental is offering free CE to everyone in the dental industry right
Yeah,
now.
true.
So yeah. So if you go to aspendentalce.com/welcome, you can find our free CE and you can take advantage of it. So
That is
it's
so
pretty
awesome.
neat.
Yeah, that's true.
Yeah.
I had a couple of friends reach out to me and ask me like, "Hey, can I actually get on the CE course thing with you?" I'm like, "Yes, do it." And they were not practicing with Aspen yet. I had a couple of my undergrad friends, well, not undergrad, I shouldn't say undergrad, the underclassmen from Temple reach out to me, and I'm like, "Yeah, it's available to everyone and anyone. Feel free to."
Hmm. Right. So there's a question which you've kind of you have fast tracked for sure. Someone's asking how many years it usually takes to go from associate to practice owner. And the correct answer,
The correct answer. The correct answer.
you're not the correct answer. You're an anomaly. We do have very many people that, progress very quickly. You might be breaking a record. I'm not sure. I mean, because it's going to be 18 months, 20 months.
Yeah,
What's it going to be? Yeah.
it's
So
gonna be.
typically it's 3 to 5 years. We do have people that have done it in 2 years. Honestly, doctor, you might be a record breaker.
Oh, I'm not quite sure, but I know that when people ask me like, how do you do it? I'm like, honestly, I cannot tell you that you can do exactly the same thing. It just, everything was at the right place at the right time. It just was meant to be. It was one of those things that, I know for a
Right.
fact this was the way that everything was supposed to play out. But I have a lot of friends who have gotten an MCD position within their first year of working as an associate with Aspen. So I know
Hmm.
it's definitely possible.
Right.
Now, coming an MCD 2 months into Aspen, that's different. Everyone to get there that quickly, but it is possible. Absolutely. It's totally doable. It just depends on what you want. As long as you're transparent about your desires and your, aspirations and what you expect out of your dental career, Aspen can help you get there. I'm
Living
definitely
proof.
living proof to that.
Yeah. I do want to tell everybody listening, I mean, our goal is to get you to your goal, honestly. And I tell people this because, like yourself, doctor, you took that step and went to Midland, even though you really, really wanted to get into El Paso right away, right?
Yeah.
And hasn't this time flown by?
Oh my
Like
gosh, it's gone by so fast.
so fast.
There
Yes.
there came a point at the end of my 1 year in Midland where I was like, I need more time. More time. And it's insane because I mean, granted, maybe the pandemic did a little bit of that drive of me wanting a little more time. And it worked out because I did get a little more time, to explore, to learn, to get to see other offices and how they're run, which has been great. But truthfully, it's been great. Time flies. And like I said, I was very transparent. I wanted to be with Aspen, but I wanted to be in El Paso long term. So I spoke up about my desires. I spoke up to the right people at the right time. I had a group of people that were on my side. Rebecca, Dave, and Molly, they were all people that are on your academic team that helped guide me and introduce me to the right people. I had the opportunity and the pleasure of meeting Bob Fontana on my very first Aspen CE. It was mostly what we call our vibe sessions now, and it's where you go and you get to meet a bunch of dentists that are working with Aspen, and now it's become a big recruiting fair, which is amazing. I was given that opportunity to meet with Bob and let him know, like, listen, I'd love to have a place in El Paso. El Paso is a wonderful city. I think Aspen would be great to be there, and I want to take you there. I want Aspen to go to El Paso. And look at me now. I am talking about interviewing people in September. It's 2 weeks from now, which is amazing.
Right, right. And that speaks volumes about Aspen Dental. Bob Fontana is our founder and CEO, and he's an incredibly approachable person. You were able to have that conversation with him, and he's all ears.
Yeah.
So, he wants to get you to your goal. Oh, this is so sweet. You have an alumni making a comment about your drive and passion towards all of your dreams. And no one was more of a go-getter. So awesome to hear your story. So former classmate is online, just giving that shout out to you, Doctor.
Oh my God, Sandro, you're up. How are you?
So that's fun.
Hello. It's so good to hear from you, and thank you so much. I miss you. I hope you're doing great. And I'm so grateful to have had that opportunity to, be your classmate and to be your friend. I'm so grateful. Oh, man.
That's fun. So fun. Right. So, everybody has a different goal and a different path. Some want to go into private practice, some choose a DSO, some choose the best DSO, Aspen Dental. But, what is the advice that you would give a D3, a D4 when they're starting to think about their career steps?
So
what advice would you give?
I think the most important thing is to be true to what you want to do. Know that you are able to decide what you want. You don't have to go into dental school knowing what you want to do. You can change your mind. Really give yourself an opportunity to see what's out there and what you like, what your passions are. And if you need some time to decide that, you don't have to decide right away. I think I know a lot of my classmates decided to go into Aspen DSOs not knowing what exactly they wanted to do in the long term, but wanting to try to do and work in dentistry. And Aspen was a great opportunity to go ahead and, dip your toes, get ready, start working, and really hit the road running. I know as a D3 and a D4, be as willing to try and venture into procedures. Don't be shy. Learn as much as you can. Get all of the information that you possibly can from your great faculty and learn as much as you possibly can from them, because the more you try in dental school to do the harder cases, to get the more difficult treatments done, the more you'll be able to do when you're out of dental school. Don't be shy. Don't worry. Go for those surgical extractions. Of course, make sure that you have an okay from your faculty, faculty always, but don't shy away from that stuff. You're in dental school right now. Take advantage of your faculty. Don't shy away from trying something more difficult because you don't want to ask for help. Make sure you take all that opportunity right now and really grow from it.
Oh, that's excellent advice. Excellent advice. So we can wrap up here. I just really want to thank you so much, Doctor, for being with us tonight. I love your story. It's so motivational. And I know everybody that's listening feels the same. I mean, how can you not? And this is a great video for our, library. We can share it with people that are wondering about, taking that chance and that fast track to ownership, that you're going to be doing right around the corner here. So I just want to congratulate you. I'm really excited for you. And thank you so much for being with us tonight.
Thank you. Thank you for having me. It's been my pleasure. If you guys have any questions at all, Maggie, you can share my information so that people can reach out. Sometimes I know it's not so easy to ask during these webinars. If you have a question that you want to shoot to me, feel free to do so. I'm all for answering anything and everything I possibly can. And I'm super duper transparent. Anything you want to know, I can let you know about.
Okay, excellent. Everybody have a great evening and good night.
Thank you. Bye.
Bye.
Say bye to the girls for me.